Good morning everyone. Myself Dr. Geetanjli Chawla, Assistant Professor from the Faculty of Physiotherapy, RPIIT Campus, Karnal. Today we are going to learn about pre-operative assessment, and welcome to our YouTube channel, that is RPIIT Academics. Please like and share the video, and do not forget to hit the subscribe button, and do not forget to hit the bell icon also. So starting with the pre-operative assessment after any abdominal surgery. So first of all, we have to read the notes and details about the condition of the patient. Then we will assess the respiratory function. We will check for the circulatory problems, and then we will check the detailed history of the patient. So what will we do in the clinical notes reading? We will look for any type of comorbid conditions. We will look for the cause of the surgery, or if there is any other note given by the surgeon, we will also read that out. Then proceeding on towards the respiratory assessment, we will look for the symmetry of the chest. We will look for the rate, that is respiratory rate, depth of the respiration, chest expansion, dyspnea. Dyspnea is the shortness of the breath, accessory muscle involvement, and measurements of while the chest expansion at the axillary level and at the nipple level and at the xiphisternum level. We will take that measurement with the help of inch tape. Proceeding on to the circulatory assessment, we will look for the Homan's test, and if any, we will look for the edema if there is any. Then coming on to the history taking, one should have to look for the medical history if the patient is taking any type of medications, or we will look for the subjective history or personal history related to the patient. Proceeding on to the pre-operative training, these are all the pre-operative training which we will give to the patient, that is starting with the breathing exercises. What all will we be teaching to the patient is diaphragmatic breathing and local expansion exercises. We will teach him how to cough, and we will also teach the real mechanism of cough to the patient by supporting the incisional site. We will give him some arm exercises, short lever and long lever both. Then coming on to the leg exercises, ankle and toe movements, static quads and gluteus, and posture correction advices will be given. Ergonomic advantages or ergonomic advices will also be given. Coming on to the post-operative assessment, surgery notes reading will be consisting of type of incision, type of anesthesia, duration of the surgery, immediate complications or unwanted events during the surgery, and management plan. All this should be in your assessment form. Vital signs checking, we will look for the vital signs like tidal volume. The normal value of tidal volume is 2 milliliter per kg body weight. Minute volume is 100 ml per kg body weight. FVC, forced vital capacity, is 70 ml per kg. FEV, when forced expiratory volume 1, is 70 to 90% of FVC. Partial pressure of oxygen should not be less than the 70 mm of Hg. Partial pressure of carbon dioxide should not be more than the 50 mm of Hg. Respiratory rate should lie between 12 to 16 breaths per minute. ABG analysis, that is arterial blood gases analysis, should be done. Pulse oximetry, PR, ECG, pulse rate, ECG, heart sound, systemic arterial blood pressure, central venous pressure, TPR chart, ventilator support should be checked. Understanding the attachments, it is also necessary to understand the attachments like IV lines, nasogastric tube, catheter, PCA, and drains. All these will be there. So one should know which attachment is known by which name. Orientation assessment should be done, like communication ability should be checked, alertness, perceptual ability to follow the instructions, objective assessment like respiratory, circulatory, range of motion, muscle power and mobility, and functional assessment should be done. Respiratory assessment like painful breathing, difficulty in coughing, impaired respiration, accumulation of secretions, palpitations and auscultation should be done. Circulatory assessment should be done. Posture and mobility should be checked, like kyphoscoliosis should be checked, bed mobility should be checked. Pain assessment should be done by VAS scale or MP questionnaire. Thank you.